everyone has their poison. For some, it's a bottle. For others, a pill. And yet for many, it's a spiral into darkness. Drug and alcohol addiction, a prevalent problem that spans the globe, is a haunting reality that affects individuals, families, and communities alike.
Talking about drug addiction, I think that we need to understand that it's not just, we're thinking about addiction in the context of different types of substances, right? So it could be alcohol, right? It could be drugs, it could be different types of substances. And I think individuals who have an unhealthy, uncontrolled, use of different substances uses that cause them physical harm.
Addiction is defined as chronic relapsing brain disease that is characterized by compulsive substance seeking and use despite consequences.
It's also relapsing in nature. You find out that an individual takes a certain drug or abuses drugs and will tell themselves that, oh, I'm doing this for the last time. And then they still find themselves going back to using on and on and on.
Even though you know that this is the nature of the disease, it's in its nature to relapse. It's in its nature for the person to perhaps seek out substance again sometime, right? But still, you still feel some type of way as a clinician that has been working with a patient throughout their recovery journey.
I started getting high with alcohol and weed. I started doing crime to the point that the dealer would call me and tell me that I should stop. But I couldn't stop. I didn't understand myself. My focus was just on getting high.
There are people now, they now have what we call personality type disorder, right? You see one that because of the drugs he's taking is already getting to a point where he's losing human feeling. Does he have conscience again? So most people that want to do wicked things now, they get high before they can people that armed robbers, kidnappers, and we have the rise of that in our community now. I believe personally, there's no research work for, but I think one of the things that is increasing, that is affecting the increase of crime rate in Nigeria is drugs.
Through the production process of this documentary, I have learned how profound the consequences of addiction are, tearing families apart, shattering friendships, and commanding unconscious reflexes too. Communication becomes strained and relationships become battlegrounds filled with pain, resentment, and frustration.
I was taking cocaine once in a while during weekends, and I was introduced to crack. They brought it to the office and they showed me, and I was looking at them and I said, this is a no-go area. But I was curious, and one day I was very drunk and I said, let me try it. And that was the beginning of the end. And my marriage didn't go well. My wife carried my daughter and left.
I smoked for about 9 months and I had a psychotic break one day. This is basically the episodes people have where they have schizophrenia. They're called psychosis. This schizophrenia was triggered by smoking marijuana.
Some withdrawals that the people might experience if they're not using the substance, what happens to them physically? There's a physical withdrawal. There's also the mental withdrawal. Physical withdrawal could entail that the person shakes when the person isn't using the substance. It could be some person feels restless. Some might have aches. They might have fever. So these are physical withdrawals. And the mental withdrawal, which is obviously the cravings to use a substance and the feeling of unease when the person is not using the substance.
Addiction may be a complex and challenging battle, but it is important to remember that recovery is possible.
Mental illnesses or addiction is just one of those diseases or illnesses that anybody can come down with, and they should not attach any form of spiritual or moral or immoral, moral decadence to it.
I thought it was a moral issue. I thought it's because I didn't know God. All I know is that they will come and pray for me. Imam will come and give me different things to drink and stuff like that. But still, I just knew that there's something that was not right. My love for drugs was more than anything else. I got to a rehabilitation center. I think it was my 14th or so. I can't remember. But when I got there, all those ones I went to in the past, I'll be chained for 6 months. They'll flog me every morning and all those kinds of things.
Then there's also the problem of people, when they have mental health issues, instead of going to the hospital or going to see a mental health counselor or seeing a psychologist, they rather go to their pastor or go to their religious leader.
People will think that somebody who is, having psychotic episodes or maybe is having manic episodes and things like that, they start fasting and they calm down, not knowing it's just because they're hungry and they don't have energy and they're tired, but they think that that's healing them, right? So I think that one of the things we need to do is that we need to recognize the role of faith. There's great organizations out there like Luxterra, which is doing trauma-informed counseling and spiritual-based discussion, working with faith leaders, working with clergy to discuss how they need to understand mental triggers and understand that if there's a challenge, right, then those people need to be referred.
Therapy is a process of professional intervention that aims to promote positive changes in thoughts, feelings, behaviors, and overall well-being of individuals.
When we come to rehabilitation, it is not only about the drugs or the mental illness. It is the entire person we are rehabilitating. Physically, mentally, psychologically. So a lot of things goes into it.
There's little awareness on it because people think, oh, you want to go to a psychiatric home. So people are already thinking, extreme cases of psychosis. That's why, right? But that is not correct. And it's making a lot of people not access the help that they actually need and shying away from it. And also the raising of awareness, we are fighting the stigma.
The stigmatization topic is a very huge one. Before you talk about even the centers trying to address the issue of stigmatization, the most important thing that we now try to do is to, of course, to be able to educate the public, to psycho-educate the public.
Some of these documentaries about mental health and how things are being run in facilities. Because the problem is that people think that when you hear rehabilitation, it is just where they chain people and then flog them. It is not. In short, we have seen in the rehabilitation center, it is a sort of miracle because patients come in terrible for 10 years, and then when you treat them, they get better with medically, psychologically, and then we'll be able to reintegrate them into the society.
Through one-on-one sessions or group therapy, individuals explore the underlying causes of their addiction, gain valuable insights, and develop coping mechanisms.
My parents and the family was really not getting along at the time. They were divorced, and I felt different. I would look at my other friends that have, families that made sense to me at that time, and I felt like a victim. I started mingling with other people, and before I knew it, I started smoking. And when I tasted alcohol and drugs for the first time, Indian hemp and all of that, I felt free. It was a buzz. I was so happy. But as God would have it, I got to a rehabilitation center. They were professionals. They were experienced. They understood. They didn't judge.
It was just an act of curiosity, actually. I was in college at the time in America, and my friends and I wanted to try new stuff, get a little drunk and smoke a little weed. A month later I was hospitalized in Atlanta, Georgia, where I was staying, and this was ahead of me moving back to Nigeria. And at the airport, the day I was traveling, I was still having psychosis. So I came back home, and some of my family members said, there's this place where people could really help me to do what I couldn't while I was abroad. I stayed for about 2 months, and They completely stabilized me.
I think we're in a drug pandemic, not even an epidemic again. We're in a drug pandemic. I don't even want to go to Africa. Let's just focus on Nigeria first and foremost. And I think, of course, it's extending to other African countries. But we're in a drug pandemic. You can hardly go to a party now and not be offered one psychoactive substance or the other. It's impossible. I'm not even talking about just alcohol now. I'm talking about people bringing a plate of marijuana or cocaine and say, which one? What's your poison? And somebody bringing pills like, what's your poison? And I know we've seen videos of people opening their tongue, blue tongue, and that's ref. They call it ref, Rohypnol, right? So you can hardly go to social gatherings now and not be offered one psychoactive substance, illicit, or the other.
Therapy treatment programs have given countless individuals a second chance at life through their journey of healing and transformation, helping them rediscover their purpose.
Our wellness pillar is, if you think about the different therapeutic approaches, there's holistic therapy. So that's where we think about things like yoga, things like meditations, things like affirmations, etc. During those conversations, we have wellness discussions monthly, where we have individuals talk about a certain issue.
When they came and we started talking, I started receiving treatment. They introduced me to something called NA, Narcotics Anonymous. I had sessions. I was told that it was not a moral problem. I have a drug use disorder. My brain is different.
I found out that this facility has DSTV, a pool table, a table tennis table, video games, FIFA 2021, and all of that. We also had sessions, which is the 12-step program that is a conventional practice all across the world. It's actually for people dealing with some kind of drug or alcohol abuse. It's kind of a spiritual thing.
I think for the first time in my life, I remember I didn't used to pray. If you ever saw me praying, then it was a scam. But I found myself for the first time when I knew that things were going right. I prayed and I started crying at night, and I was wondering what was this happening inside. It's a spiritual thing too.
Addiction may be a formidable opponent, but just as you've seen from our sources, it doesn't diminish the potential for change and possibility of a brighter tomorrow.
Now I'm a better father, I'm communicating with my kids, and when I come home, they run and jump on me. They don't ask, Daddy, why are your eyes red? Why are your clothes smelling of alcohol or something else? Daddy, where have you been? No, but they are happy. My parents, luckily for me, they're still alive. There was a time I actually wondered, what if I'm using this drug and my parents die, knowing that I was into all that, feeling like they were failures. But now I have the opportunity.
The actual truth is I don't regret the schizophrenia because it made me fight for my life. So I feel like I'm very much active as an actor of my own life.
So if you or someone you know is grappling with addiction, remember that it's not a lost cause. Seek help, surround yourself with support, and believe in the resilience of the human spirit.